Lupus is a type of what we call connective tissue disease. It's actually quite rare, but there are a number of conditions that are related to it, and they're all conditions where the body's immune system has gone wrong and is causing inflammation. Lupus is a very variable condition. Most people with lupus will get some form of joint pains, and rashes are quite common as well, often relating to sunlight exposure. But there are a whole host of other symptoms that people can get with lupus, and it really varies from person to person. Fatigue and tiredness are a very common symptom. Many people get Raynaud's, where the fingers change colour in the cold and go white and blue. And there are a whole variety of other symptoms that can occur in lupus. Not everyone will get these though, but sometimes they can cause a bit of inflammation in the lungs or around the heart. The types of symptom that are perhaps more serious though are when lupus starts to affect the kidneys, and that's something that needs a lot of quite urgent treatment. But fortunately, most people with lupus don't necessarily get that. The reasons why people get lupus are quite complicated. A lot of it is rooted in genetics, actually. We know that there's a whole load of genes that can make you a little bit more likely to get lupus. And at the last count, there was probably 100 of those genes. Most of them are quite weak. So if you've got one of those genes, it doesn't really matter. But if you've got 10 or 20 of those genes, then your lifetime risk of getting lupus is a lot higher. We know that hormones are important, and lupus is about 9 or 10 times more common in women than it is in men. And the impact of pregnancy and menopause can affect how lupus is activated. Beyond that, we know that there are some environmental influences that can trigger the genes to start lupus. So things like smoking or bugs, infections in the environment that people pick up can actually spark the process of lupus off. So with lupus, it's really important to try and have a healthy lifestyle and eat well, don't smoke, have a good diet. That's probably not enough. It's very important to act and be healthy. But with lupus, there are lots of medications that we use. Most people are recommended to start a drug called hydroxychloroquine, which is a drug which used to be used to treat malaria, but it's often very helpful at treating things like rashes, joint pains, fatigue that people get in lupus. Moving on from that, if that's not enough, then we sometimes use stronger drugs, often steroids to suppress the immune system, and other immunosuppressants called azathioprine or mycophenolate. And excitingly, there are some newer drugs which are called biologic drugs, which are much more powerful for the few people who are unlucky enough to get more severe side of lupus.